तो वो आके फिर बार बार निपल को फाइट करेगा ग्रिप करने के लिए. So just a simple lifting, just holding the baby can do wonders in such cases. ये निपल पुलिंग वाला, इतना लेवल का इंजरी होता है मदर को. So we have to be very cautious कि हम निपल पुलिंग अवॉइड करें, ना ही करें. अवॉइड तो छोड़, करना ही नहीं है. सिंपल निपल को लेके, if this areola is held between two fingers and if you just roll it like this, still the flat nipple will come out. You don't have to nipple pull it. Milk expression के लिए also people are using nipple pulling कि वो syringe से milk निकालेंगे. But like I said, ये सिर्फ नल है, टैंक यहाँ है. So यहाँ से milk उतना नहीं आएगा. So there is no point in putting the mother through all this. Take a pump. Advise her rather than the syringe, get a manual pump at least, ताकि वो उसको help करे, rather than putting her into more pain. Now my personal experience, I'll just share. My baby was an NICU baby. He was born preterm. This is not about breastfeeding, but it is about homeopathy and how it can help in our NICU situation. Obviously, I know यहाँ पर NICU में homeopathy use होता ही है for babies. So my child was 31 weeks born, 1.7 kgs. He used to get hypoxia episodes. He used to get hypoglycemia episodes, because of which उसको NICU से बाहर ज़्यादा देर निकाल ही नहीं पाते थे. And that's when I broke down. That's when I thought, हम सबको homeopathy देते हैं, हम अपने बच्चे को क्यों नहीं दे रहे हैं? And these were my literal words कि सबको, पूरी दुनिया को हम होम्योपैथी देते हैं. We started him on homeopathic medicine NICU से छुपा के. When I would go to feed him, I would just put a little powder on the nipples when the baby is feeding, and the baby would take the medicines. Within 2 days, hypoglycemia episodes stopped. Oxygen का need completely stopped. 3rd day पे baby was out of the NICU. So that is the magic homeopathic medicines can do. We just have to look for, अब वो इतना छोटा सा 8 दिन का बच्चा है, but still you have to observe for symptoms, you have to observe for their behavior, their characteristic symptoms, and how homeopathy can help in all situations. फिर वो मदर को भी हेल्प करेगा उसकी मूड में, और बेबी को भी हेल्प करेगा. That's it from my side. Thank you. If we have any queries, I am open. Okay, that's it then. Thank you.
Yeah, I have some questions.
Ji, sir.
Yeah, I just wanted to know, you have not mentioned about the posology.
So actually, the basic about this presentation was not teaching homeopathy and the medicines, but how homeopathy can help in such situations. Because we have nursing staff also, and it is, मुझे ऐसे बोला गया कि प्रॉपर पूरा सब होम्योपैथी नहीं पढ़ाना है. It has to be it has to involve other members also, non-homeopathic staff also. So because of which I did not go into the details of it.
Yeah, so if you could give us a general idea of whether the same methods of potency selection was applied or was there anything different?
नहीं sir, same sir. होम्योपैथी कैसे change होगा? Principles are same sir.
Okay, fine. That was one question. And so then, in terms of repetitions, did you require frequent or infrequent? What was the general experience?
Sir, जैसे the case with protontic, it required frequent repetitions. The case with mastitis required frequent repetitions, but वो 2 दिन में settle हो गया था, तो 2 दिन medicine देके we just stopped it. Constitutional वाला, I am still continuing the mother on the same medicine.
Again, so susceptibility and the clinical condition decides the
Yes.
reproduction.
Yes.
Okay. So that was really very wonderful sharing from Professor Sarita. I think what points was emphasized we come to it once Dr. Ukra and all others have anything else to say.
So no, sir, you can go ahead. Any questions from students you are waiting for?
Yeah, let us get it from the students.
Any question? सिस्टर तुमच्याकडनं नक्की एक प्रश्न पाहिजे तुमचे काही डिफिकल्टी असतील किंवा काय तुम्ही विचारू शकता
बिकॉज तुम्ही लोक कसं ग्राउंड लेवलवर बघतायत पेशंट्सना मदर्सना सो तुम्हाला काही असेल प्रश्न वगैरे तर प्लीज फील फ्री टू आस्क
नाहीतर ते प्रश्न विचारणार आपल्याला म्हणून हा ना मॅडम नाही ठीक आहे
Nipple pulling. She's telling it is good because it is really painful for the mother.
ते तुम्ही शिकला
कधी मदरच सांगते की असं सिरिंज वगैरे लावून खेचा कारण ते एकदम वाईट पेनफुल असतात.
Yes, sir. Sir, you can go ahead now and you can conclude the part.
I think we had a very holistic presentation by Dr. Sarita. And what was important today, what was English is fine, right? I continue in English only.
Yes, sir.
Yes, sir.
Okay. The important point was focus on the faith and the confidence of the mother. That plays a very, very important role in seeing that the breastfeeding gets begin as well as when it gets initiated. Because right from the time of pregnancy, we have to keep on boosting the mother that it is a very important aspect of child care. So the whole family as a team is responsible in ensuring that the mother has the confidence of being able to breastfeed the child. So I think it's all a team effort that we have to do. So that's the message which I got when Dr. Sarita shared about breastfeeding. And yes, many of the problems can be sorted out if this orientation is done properly. So if the mother herself looks forward for breastfeeding, 90% of the problems are sorted out. Number two, I think the role of homeopathy in helping, initiating, continuing, and solving the problems of breastfeeding has been demonstrated. Beyond that, Dr. Sarita has gone ahead and further shared about her own personal experience of how homeopathy helps in even premature children. So homeopathy has got a huge role. We need to be able to properly identify it and see to it that it is implemented. Because homeopathic prescription is not simple. A lot of observation has to be done to be able to prescribe. So that observation, if we are able to do, then it is possible to prescribe. So we thank Dr. Sarita for giving a wonderful thing. And I am sure there is something else planned about actual demonstration.
Yes, sir.
Yeah, some demonstration is planned.
Yes.
Yeah, so I think that will be further help. Thank you, Dr. Sarita.
Thank you, sir.
And of course, they would thank Dr. Kamlesh Jain, the better half, the other half, for being along with her for this presentation as well.
Support group. Support system actually. See, I tell you, he is someone who pushed me. I was very skeptical. मैं कर पाऊंगी कि नहीं कर पाऊंगी. This is a very real raw experience. I must tell you. Better half, जो sir बोलते हैं ना, it is always a better half only because I was very 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 skeptical. Offline है, NICU जाना है, going back to my own experience, going back to through that trauma once again. Then Jana every time to the hospital, coming back, you come back tired. वो पूरा, though it was not very frequently that I didn't have to visit every day, but still Jana आना, school देखना बच्चे का, tiffins and everything. He was the person birthday tiffin to जाके आ. So I am blessed in that way. He is really a better half.
Yes.
The real support system. They pushed me कि नहीं करो.
I think there are mothers like me and Namrata in this group. She can share
Please,
what
ma'am,
she
please
went
come.
through. Very important because yes, Namrata, please go ahead.
Then Sonali ma'am.
Sonali ma'am.
And then Sonali ma'am.
Sonali ma'am.
Sonali ma'am, yes. Sonali ma'am is actually reached.
Yes.
First question is that whether we
Ma'am,
are
please come.
again.
Thank you, Sarita ma'am, for the wonderful lecture. It was indeed thrilling. And whatever you have said, exactly, it's from the experience. And I can say people think that breastfeeding is easy. It is not for certain mothers. It is really, for some people, pregnancy is easy. For others, pregnancy is little complicated. And breastfeeding also applies same. For some mothers, breastfeeding is very easy, and for some mothers, it is really a challenge and difficulty. If I have to share my personal experience, my pregnancy was very complicated. During third month of my gestation, I developed subchorionic hemorrhage, and I was put on bed rest. I continued bleeding for around 2.5 months. So when I started with my first report for gestation, the HB was 12.6. And after that 2-3 months the HB became 7. So I have gone through whatever complication was possible in the books. My body has suffered that. So I thought that after I actually, there was pain, contractions, but baby was not coming out. I underwent LSCS. I could not tolerate that pain. It was very very much. I thought कि एक और अगर contraction आएगा, I'll suffer an epileptic attack. इतना ज़्यादा pain था, and the journey is little complicated. I thought चलो अच्छा है बच्चा आ गया, now everything will be easy, but it is not so, because ये जो आप लोगों ने बोला ना, आपने बोला ना sisters, family pressure, other mothers, so we have to be patient. Colostrum first second day आएगा, 3-4 दिन लगता ही है मिल्क आने को अच्छे से. So be very patient. I suffered from sore nipples and it was very difficult to feed. और पहले मैंने क्या किया, breast feeding ही तो है, it is easy. So I thought कि कोई जरूरत नहीं है, lactation consultant की जरूरत ही नहीं है. But एक महीने बाद मुझे वही करना पड़ा. We doctors, even gynecologists feel that उनको भी नहीं पता कि ये लैचमेंट टेक्निक कितना इम्पोर्टेंट है, and you reduce the pain and suffering only by proper latchment. Then the lactation expert taught me proper latchment technique, how to hold the baby, और इतना डरना नहीं, जैसे बेबी ने जैसे ब्रेस्ट पे रखा, I used to just shout. इतना ज़्यादा painful वो experience with burning sensation and complete, it is a bad experience. But when proper latchment happens, no magic happens. First time I fed the baby, it was so, I used to pray that at least breastfeeding should be easy to me, because I have suffered a lot during my gestation. So at least I should experience the love of breastfeeding. Itna to Bhagwan mujhe de de. Then after the lactation consultation, then things became really possible for me, and I could feed my baby properly till weaning, and properly till 2.5, 3 years. कोई दिक्कत नहीं आई, लेकिन वो एक advice was a miracle. It's a very nice. आपने जो advice दिए breast pump का, that was really. Nipple protectors, जो silicone nipple protectors आते हैं, they are also very good. So I think it is a very wonderful and very enhancing and thrilling session. And thank you, pediatric department, for arranging this. It is really difficult. We cannot understand pain unless we experience it. And एक और चीज मुझे बोलनी है कि हम कभी-कभी ऐसा, जैसे कि LSCS हुआ है, we should let the mother also rest. Breastfeeding is one aspect, but we should not be harsh towards them. कि चलो चलो उठो, अभी ऐसे लेटे रहोगे. This is not the language. ये थोड़ी language avoid करनी चाहिए. माँ को अपने बच्चे को दूध पिलाना ही है. She will do it. It's all mind game. What madam said, no, कि आपको उसको positivity देनी है, so you have to give. Especially in cases where antenatal anxiety बहुत रही है ना, mother can go into postpartum depression. So ये सारी चीजें हमको consider करनी बहुत जरूरी है, और उनका एक word, एक sentence. I have gone through this, so I'm telling कि we have to be very gentle. सिर्फ माइंड गेम है, 2-3 दिन में आएगा दूध, आप फोर्स मत कीजिए, कुछ नहीं. एंगॉर्जमेंट है, उसके लिए भी उन्होंने जो भी बताया वो सब एब्सोल्युटली करेक्ट है, कि मैंने सारे कॉम्प्लिकेशंस झेल लिए हैं.
Thank you, ma'am.
So I would like thank Sarita ma'am for this enriching information. I had 2 experiences with both my babies. So the first experience was very close, like what Sarita ma'am shared. My baby was near term. I had a normal delivery, but yes, I had difficulty to initiate breastfeeding. So 6 hours I did not go near my baby. My baby was not in NICU. But then, yes, it was difficult. So during the second time, and the baby was on formula also with breastfeeding. But I didn't give up. I continued till like good 1.5 years with her. And for the second time, I was damn determined that this time I will go for breastfeeding. I got great support from my gynecologist at that point of time, he knew that I am determined. He helped me, and then I could successfully breastfeed my second one. The thing is that it's all in the mind. It is really important to know yourself, what you are undergoing, to consciously understand what the environment is and what you are and how you are reacting to it. We as homeopath, we understand our own self, and it actually helps to, cope up with your own battles sometimes. So as a mother, when you know your body, you can actually help this let down process in a more better way. I would request Dr. Omkar. I have expressions.
That's very nice, Sonali, and I was hoping that someone will give that. And I'm very happy, Sonali, that you did that. So yes, we'll make that to hear from Omkar.
Yeah, he has a very fresh experience from the other side of the fence. It would be nice to hear that.
I was also thinking that मेरा number आएगा. Yes, means from the knowing the news of conception, there also pressure starts building at the father side, and then being with the wife and being with her in that initial struggle period. And in my case, suddenly there was due to emergency LACS was done because of PI in the 7th month, and baby was also in the NICU immediately. He was 1.9 kg. That phase was very tremendously pressure. Means we are doctors, we know all the thing at a level, and then we were facing as a father of the in a hospital. Because everyone will not know who is doctor or something. I was simple father. So then at that time we realized what a patient or the one who is sitting outside, anyone's father or relative of the patient is suffering in the OPD or in the IPD, smallest thing. It's like for that time NABH will do na everything. So importance of that to for smooth running of the hospital everywhere now. That was Wobart hospital, so definitely the standard and everything, the rule and all the streamlining thing was different. So that was at the hospital level. So for smoothness of a patient, and from this point of view, the orienting while being with the wife, she also had difficulty in the initial part of breastfeeding, and the as ma'am said, all the common norms or common misbeliefs which one have, and it is there in the mind of the mother and also the relative. So he was in NICU for 2 weeks, and the day he entered, I mean, the day we brought, he got discharged. It was Christmas, 20th December 2024. So our Santa Claus came. As he came, that day only we called a lactational consultant. We came to know importance of lactational consultant. Definitely gynecology shared, and we were planned. So I had called ma'am immediately. So I thought it was Saturday or something. So I thought ma'am will come on Monday. It was 5-6 p.m. sir. Ma'am, lactational consultant, Chanchal ma'am. Ma'am also knows her. So I called her. She said, "Acha, acha. Okay, so come for delivery and all those things." We came. Oh, I will come right now. It was 5:30 or something, and ma'am was planning to come at 7 p.m. 6-7. So ma'am, चलेगा बाद में भी ऐसा कुछ नहीं. Tomorrow I have an operation. Some operation ma'am had. So she had a planned admission that night. She will be fasting. So in spite of that, ma'am came at 6:30, and I had an exclusive session with both the mothers. I mean, sorry, mother-in-laws. I mean, mother के mother है ना, दोनों जन. तो first day को problem sort कर दिया मेरे, मुझे लगा my luck bad. I have a video photo of that also. Mother baby sitting, and both main mother तो also is sitting. The in-laws and her mother, both ways. So all got sorted. My mom even hugged her. Thank you. Yeah, खूप चांगलं बोललात तुम्ही. And it was emotional for all the three mothers. It was the process. Everyone felt that. So very first day we got that, and then later on we had difficulty. We were in touch with the ma'am, and gradually it went smooth. And now the baby has gone weight also, and it's thankfully everything is good. Thank you. Giving me the opportunity. Thank you. Thank you.
You say something? Okay. Sure. Yeah, Dr. Sujata would like to share something. Yeah. Sure.
Yes, now my children are grown-ups, and my daughter is having a son now, who is just today only turned 2 months. So when I started with the Bhupali setup, and when we started with Bhupal madam, who is an expert in all the breastfeeding, I might say, the first 1,000 days of the baby and the feeding and alternative feeding and everything. The first thing that she had shared got a very profound effect on me was that it doesn't matter about the breast size or the area or the nipple, the baby can feed on any kind of breast actually. I had a very personal experience which was not very good because my breast size was small and my areola was small, my nipple was small, and I used to always feel that it is not enough for my first child. And unfortunately, at that time, we didn't have any lactation consultant, so that thing had remained in my mind, and I was actually very great to know that any breast is good for the child, for the baby. And that was a that's like a miracle. After that, I never had any difficulty in counseling any mother or even my daughter or anyone for that matter. I had opportunity to counsel few mothers about breastfeeding, and that really helped. So yes, I think if you are oriented to what are the techniques and what is good, what is not, what needs to be done, I think that helps. In fact, Rupalala madam had demonstrated a breast sprawl at Mumbai, and that was also an amazing thing to witness actually. So it was a breast sprawl, and immediately after birth, she had put the baby onto the mother's tummy, and she had demonstrated how a baby will actually seek the breast, and it is all very natural and normal, so you don't need to feel or do anything about it. It just happens. You just need to have that faith in the mind, and I think that's what is the positivity that is more needed. So it's really great. Yes, that is what I just wanted to share.
Okay. So Mother Nature is very important, right? So Mother Nature, let's all be with Mother Nature.
Freedom sister.
Yes. Yes, sister, please come. Please, yeah, बोला ना.
मराठीमध्ये बोला.
मराठीमध्ये बोललं तरी चालेल. हो, चालेल. ठीक.
जेव्हा पहिल्यांदा बेबी म्हणजे आधीचं जे फर्स्ट बेबी होतं ना ते 2.2 होतं मग ते
नाही चालेल, ऐकतोय. वी आर एबल टू हिअर.
पहिलाच फर्स्ट बेबी होतं ते 2.2 kg होतं तर ओबेसिटी वगैरे ट्रीटमेंट ते
ओके. ते तुम्ही बघितलं एकदा म्हणून का?
माझं सर
व्हेरी गुड.
आणि सेकंड बेबी साठी पण होमिओपॅथिक ट्रीटमेंट देऊन
म्हणजे तुम्हाला आता
दोन
सोप्या पद्धतीने कसा बरा होऊ शकतो बाळ ते पण कळलं नाही का? होमिओपॅथिक औषध देणं एकदम सोपं आहे नाही का?
आपण सर सांगतो आणि तर मदर असतात मदरला आपण जेव्हा सांगतो तेव्हा मदरला असं वाटत असेल की सिस्टर ओरडतात पण जेव्हा आपल्यावर वेळ येते तेव्हा
थँक्यू. छान बोलला.
Kamlesh sir, can you please come and share your experiences with?
I don't want to share anything.
Sir,
Few words.
Please sir, just a few words
Yeah.
regarding the session, regarding your experience.
Popular demand. We want Kamlesh to speak a few words.
See, as far as breastfeeding is concerned, I have no experience as such. But I would like to share our nice experience. Like Sarita said, he was going into hypoglycemic event. So immediately that time I was working with Bipin sir. So I had only one thing in my mind: कि sir को phone कर, हो जाएगा. And that day, and she had the guts and courage to take the medicine inside the NICU. I didn't have the courage even to ask the pediatrician कि मैं होम्योपैथी दूं क्या. क्योंकि मैं पूछता था ना तो वो यही बोलता था अगर होम्योपैथी से ठीक होता तो इधर क्यों लेके आए. क्योंकि मेरा 2 बार आईसीयू स्टे हुआ है तो आई नो एवरीथिंग कि कैसे वो लोग बोलते हैं. कोविड में जब मेरा आईसीयू में था तो सर ने मेडिसिन भेजा था कुछ लेने का नहीं. इससे ठीक होता तो यहाँ पे आता था क्या तू. सिंपल लॉजिक था. But she was very courageous, I would say, and she is very, very courageous. So she took the medicine inside, and we saw the magic of the medicine. Immediately, the rate of hypoglycemia and hypoxia was reduced dramatically. And because of the homeopathic medicine, the stay was reduced. Otherwise, the stay would have been 1 month or more. But because of our early intervention, I would say early intervention, the stay was reduced to 2 weeks. And I have seen many cases in NICU where we introduce homeopathy at early settings and we are getting very, very good results. Not being a lactation consultant, but as a normal homeopath.
Okay.
And for today's session, I think she did a fair job.
Thank you. Yeah.
Thank you, ma'am. Thank you, sir. And now we move on to the most awaited segment. We had an amazing response to the e-poster competition on the topic, the gentle touch of homeopathy, supporting mothers through breastfeeding difficulties. Well, not all wounds are visible, right? Sometimes what a mother really needs is someone to say, it's okay, you're not failing, let's try again together, you're enough. Our MD students have captured this beautifully in the form of e-posters, combining clinical insight with empathy and art with awareness. We are fortunate to have Dr. Devangini ma'am and Dr. Sujata Gowda ma'am as our judges. So I request Devangini ma'am first to please.
All the posters can be seen.
Yes, sir.
That will take a lot of time, so we'll be showing only the three.
So we'll be showing only the 3 posters right now
Okay.
because of time constraint.
Thank you.
So I request Devangini ma'am to please share the process of judging and narrowing down.
Yes.
And most important thing, the prizes have been sponsored by Kanhaiya Lal Pandya sir. He has entire heart and might. He has sponsored 3 pediatric stethoscopes to the winners. So Devangini ma'am and Puna ma'am will share their experience and then we'll move on to the winners.
Yes. Good afternoon, all. I'll not take much time. So first of all, thank you pediatric department, thank you Omkar to make us judge to see such a beautiful posters. When you sit on the physician's chair, doesn't matter which caste you are, which age group you are, or you are married, single, nothing matters to the patient. The newly mothers are going to come to you, and nowadays gynecologists doesn't explain much. They are only rely on the lactations experts. So I have seen so many patients of mine who were, in the middle of the night, they used to call me for the breastfeeding. So it becomes it looks nice. इसमें क्या emergency होगा? But no, it is a very, very crucial and important topic, and I'm glad that pediatric department has taken this topic and made a lot of lovely posters. So it was really all the posters, 14 or 15 posters, has reflected students' hard work and artistic creativity. And none of the poster was being taken from any AI generated response. So I'm glad that you have used the ChatGPT for this. Okay. So it was really for me and ma'am both. It was difficult to shortlist the names because all were very good. But however, since the Steto are 3, so we have to, okay? So what we together have evaluated, the content. The topic was on the challenges faced by the mothers, okay? So whether that challenges is there in that is the clinical part. Along with the homeopathic aspect, the concepts were being taken consider. So therapeutic is one concept, the care plan, the way beautifully Sarita has shown. So whether that has auxiliary management has reflected or not. that was also one of our judging criteria. And how homeopathy, how your role as a physician to see that motherly, breastfeeding is not only mother and daughter or mother and child, it is a father, mother, and entire family with the bond with the child. So, how it has been reflected in your poster, and most important thing, how your NICU learning has reflected on that poster. That was also one of the parameter which we have considered. And of course, since it is a poster, so art has to be there, creativity has to be there. So that has also been allotted few marks. So that is the evaluation parameters. So I think poster J was given to me. Both of us has come to a conclusion. Poster J.
The judges were not given the name. They only have the code.
It was a double-blinded.
Perfectly, they have learned from Devagiri ma'am how
Yes,
to
ma'am.
do this blinding
Yes, ma'am.
results.
How to code it, how to
We were doing at our own level. We discussed as a department, RBC, ABCD, then 4, 0, 0, 1. Everything. Proper care. Each medicine was labeled separately and coded.
thanks to Shraddha for making us learn this coding.
So this poster, we have. I'll share the shortlisted one. Right now, I'm not giving a hierarchy.
Yeah, best three.
So, poster J, we liked very much about this poster that it is able to capture all the categories of the elements which have been responsible for the difficulties. Also, we are able to see the NICU learning कि mother को medicine दो तो fitness को भी improvement होता है. So that concept is being very well portrayed. And of course, the frequently coming up the remedies and experiences are also being shown. And it was a hand painted, so definitely that few credit goes to that as well. So this was the one of the good poster we identified. The second poster is C, which we had liked. Sorry. G.
It was G.
G.
From G, no? Yeah.
G. Okay, so this is also the homeopathic aspect is very well shown along with the causative factors and therapeutics in a very natural way with a very decent and elegant poster. So, and the last third one is the A poster. And the A poster, you are able to see what I liked about this poster was it did not refrain to only homeopathy. The auxiliary management, you can see all the care plan, right? So yeah, that was so homeopathy is not about you just give a medicine. It is the auxiliary management is also equally important, and that is how it has been shown what to avoid and what needs to be done given the ideas to the mother. And then another poster, so though there are three, but one more poster we liked much. So that was the poster C.
नहीं G हो गया C है
So here we are able to see what we liked about this poster is definitely the concept of a breastfeeding. So it's like a nurturing the soil to going toward the connection of the soul, the soul of a mother and child, and then role as a physician. So physician role is not just like but feeding with the anxiety, with the pain, with the hormonal imbalance, and then most important thing as a physician you have to maintain your patience. So all those things have been very well portrayed here. So these are the 4 posters which we have shortlisted. Now,
I think we should request Pandya sir. Concept one
So now we can distribute.
Yeah.
selection
Sir,
should we
ma'am,
say
sorry,
1
ma'am.
second third prize?
Next. Sujata ma'am. Exchange experience.
Ma'am, go ahead.
So if you can show the poster G, I wanted to say a few things about that.
This one?
Yeah.
Okay, yeah.
So I actually had, apart from whatever Devagiri ma'am has said, I had liked the top line and the bottom line.